Hi everyone, welcome to my channel. My name is Jett and I am a cardiac neuro nurse. I'm 24 years old and this is my first video. Basically, I just wanted to make this video because I want to share some tips about new grad residency. So technically I might still be a new grad. At my hospital I'm not. Our new grad residency was actually only 7 weeks of preceptorship and about 2 weeks before that of classes, which is crazy, I know. I definitely am still new, but I've kind of learned a lot of things so far. I wanted to make this video because I want to share some tips that got me through my new grad residency and that are still getting me through since I'm still on the newer side. It wasn't long ago that I had started and I was so nervous and I was looking at videos just like the one I'm making right now, because I didn't know what to expect, especially right now, entering as a new grad during COVID. I feel for you. I am so sorry if that's you. You will get through it. I'm here for you, and yeah, you'll survive and it'll just make you a stronger, better nurse. I have about 10 tips that I would like to share, so let's just get started. Alright, so my first tip is get to know your preceptor. We first started on days at my hospital and then I switched to nights. So I had a day preceptor and then I also have had a night preceptor. I absolutely loved both of my preceptors. I got so lucky. I've heard of it where the preceptee and the preceptor kind of just don't mesh well. So I know that can be possible, and from what I've heard, what you can do is just request to have somebody else. Obviously, that's up to how comfortable you feel doing that. But for me, I got so lucky. I actually had 2 male preceptors and I worked really well with them. They taught me so much, honestly, like, because I was in nursing school during COVID, some of my clinical hours actually got cut. So I kind of felt like I didn't really know what I was doing, and if it wasn't for them, I don't know what I would have done. I don't even want to think about that. So I got to know both of them and I am really good friends with them now, and I go to them all the time for stuff still, especially the one on night shift since I'm working with him. Sometimes you might not have the charge nurse. I just ask my preceptor questions and it's awesome. You just have to build that connection with them. So tip number 2, don't be afraid to ask for help. When you're new, you need to ask for help all the time. And it can be kind of hard to get over that idea. You might feel discouraged and you might be kind of frustrated that you don't know how to do something, or you've learned something multiple times and you're still not getting it, or you don't know how to do it. Especially once you're off preceptorship and there's something you don't know how to do. Do not be afraid to ask for help, because you never want to do something without knowing exactly how to do it and then something goes wrong. I have dreams like that where I didn't ask for help and then something goes wrong. So just always ask for help. Ask another older experienced nurse, and usually they're super kind and they do want to help you. So that leads me into tip number 3. Make friends with your coworkers and some of the older nurses. Something for me about a job is I love going to work somewhere that I'm friends with my coworkers. You don't want to work somewhere where you don't really know anybody and you kind of just go to work, clock in, clock out, and then you're out. For me, I love getting to know my coworkers and making long-lasting friends from doing that. So maybe start saying hi to some of your coworkers. You'll learn who doesn't really want to talk, and you'll learn who would love to talk or starts a conversation with you once you start saying hi to them. Once I started opening up to other people and just asking people how are they doing, or asking them if they need any help if I had like a quiet moment, I'm so glad I did that, because now I have some really good friends that I can vent to, or I can ask for help if they're working, and it's not a big deal because they're my friend and it doesn't feel like I'm making them bend over backwards to help me. So tip number 4 is you're not going to know everything as a new grad. I've talked to some of my friends and they still feel like they don't know everything, and they've been working at my hospital for a year. If you don't know something, find out the answer. Go on your computer, look it up. If you don't know how a medication works, look it up, or sometimes there's a medication reference on whatever charting system you have. Utilize that because it'll tell you the main reasons what this medication is used for. say if the patient is asking you something that you don't know, or they're asking about what kind of treatment they're gonna get, or what, you know, scans or diagnostic tests they're having the next day, and just say, you know, I don't know the answer to that right now, but I will look it up and get right back to you as soon as I can. But for the main gist of that tip is just don't beat yourself up if you don't know something. Especially with my residency, it was only 7 weeks, so I don't know everything, and I'm still learning. I'm learning so much every single shift. Well, this is probably one of the most important tips. This goes for anyone that's on their feet for 10-12 hours a day. So this is tip number 5, and this is to invest in some good shoes and compression socks. I have multiple different shoes that I wear now. It's kind of funny, you'll see how like nurses are always looking for the best shoe out there because our feet are always hurting, especially after like 3 shifts in a row. My feet are throbbing, but I have noticed some shoes that I have actually have really helped. So some of the shoes that I have are actually Ophos, which I'll put right here. So these, they're not the cutest looking, but they save my feet. And I've noticed my legs don't hurt as bad afterwards, after my shift. So they're kind of like memory foam, and they curve to your arch, and they just kind of feel like you're walking on clouds. They're the lightest shoe I've ever had. I have another pair, they're just Nike. I don't even remember what kind of Nike they are, but I'll put them here as well. These ones are pretty good, but I've noticed they're already wearing down, so I think they only last like 8 months to a year. I get a lot of compliments on them, and they're pretty cute, so they're okay. Compression socks. When I first was in nursing school, I didn't really understand that there's different like compression pressures. So make sure you actually look that up and measure yourself, because the ones that I was wearing, I just bought like a 12-pack of Amazon, and they literally cut into my my calves. They caused more damage than good. So I just got mine at Walmart. I don't know the amount of compression on them, but I have some tan ones, and I really like these because I wear Figs joggers, and it's cool because it kind of looks like you're not wearing socks. You know how there's that awkward like gap between the jogger and the shoe? Well, this is nice because it just looks like you're wearing your joggers normally, rather than like you could see your socks going into your shoes, if that makes sense. I have black ones for those days that I just don't, for those nights I just don't really care if you can see my socks or not. Sometimes I'll have those nights. Some other things that I have figured out over my 6 months of nursing that really helped me get through the shifts, and that would be, one of these is an Apple Watch. I have the Apple Watch 4, and I really like this setting, this screen. I have the timer just ready to go right here. The timer is really nice if you're counting respirations or doing checking their pulse manually, because you can just click it really easily and you don't have to worry about searching or going on your phone. Having the time in military actually really helped me, because I didn't know military time before nursing school, I would say, but setting my watch to military time really helped me memorize the numbers, kind of. And if you can't afford an Apple Watch, I was gifted that. They're very expensive than just a regular watch, but set it to military time and it'll really help. Another thing is a giant water bottle. So this is the Hydro capsule. I got it in pink. It's really nice because it's a flip up. So this is all clean, you know, so you don't have like the straw just exposed with all the hospital germs. And then I have this strap. It's just really nice, and it's huge. I think it's like 72 ounces or something. So I try to drink a whole one of these a shift. That doesn't always happen, but sometimes it does, and it's awesome. Another thing that really helps me is having a fanny pack. So I'm gonna put a picture of mine right here. So I just love having my fanny pack for all my alcohol swabs, you know, just normal things that nurses need every shift. So tip number 6 is make sure you eat enough, drink enough water, and just pack a bunch of snacks. Having lots of snacks readily available, I can just put them in my pocket. If I have a second or I'm going to the bathroom or something, just eat it really quick and it'll help keep you full. So I've learned, at least with night shift, which I'll make a whole separate video on about how to even survive, get through night shift, snacks are the way to go. This isn't the case for everybody, but some people feel really full after eating a meal, That happens to me. And I'm really tired after I go back after lunch. So I like to snack because it just keeps me full throughout the day, rather than I'm super hungry until my lunch break and then I'm tired after eating a full meal. So I love having snacks. I have like cheese sticks, hard-boiled eggs, turkey sticks, you know, just little things like that. And then caffeine. I know caffeine is not good for you. I may or may not have an addiction because you kind of get that like mid-shift slump. I would say I get it around like 5 or 6 hours, like right after you finish med pass, all your assessments, calling physicians, family members, all of that. I get like really tired. Well, having some sort of energy drink is awesome. I feel like at least on night shift, I wouldn't maybe be able to get away without it. Okay, tip number 7 is talk to your patient. I remember when I first started, I was really scared of talking to my patients. I was scared to touch them. I didn't want to do anything wrong. I didn't want to offend them, especially being out of nursing school and clinicals for a while. I don't know, I was scared. So what I've learned is I love talking to my patients. I love asking them, so what brought you into the hospital today? Or how come you're in the hospital? Tell me a little bit about your stay so far. It's just like really assuring to talk to your patients and get the story from them. Of course, they need to be alert and oriented ×4. Talking to your patients helps you get to know them and build that rapport with them, especially if you're working 3 shifts in a row and that patient's going to be there the whole time. It really helps you connect with them and build that rapport. Okay, tip number 8 is take things slow. Sometimes I feel like I'm going to have a panic attack or freak out because everything happens at once. And that's just how nursing is sometimes. I've realized things will be super hectic and crazy for like an hour, 2 hours, and you feel like you can't catch a break, and then it calms down the rest of the shift. Every single shift is different. But when you have those moments where you feel like you might just start breaking down and crying, which is totally fine. If you're gonna do that, just go to the bathroom or get away so you can just cry it out for a couple minutes and then pop right back out on the floor. But remember, you can only take care of one patient at a time. When you're with that patient, you're taking care of that patient. Just prioritize. It's okay to take a step back, think about what your priorities are right now, or make a mental list of the things you need to do and start with the first one on that list. And you just have to keep reminding yourself you're doing the best that you can. As long as you're putting 100% effort in, all you can do is all you can do. And tip number 9 is take care of yourself, especially right now with COVID and it being winter time and all of the sicknesses that are going around. Take care of yourself, don't overdo it. As a new grad, I really haven't picked up any overtime because it's already hard going to those 3 shifts a week. You just don't want to overdo it and wear your body out and get sick. Just try to keep yourself healthy, take all your vitamins, exercise, which I know can be so hard when you're exhausted from work. And another part of this tip would be go to your support system. I vent to the coworkers and the friends that I've made at work, and that's nice because they can completely relate. Going to your significant other and family. I vent to my mom all the time. I call her right before I go to work. Just having someone to listen and hear you out is awesome. And lastly, for this tip is just do something to get your mind off of work. Go to the gym, take a self-care day, see your friends, see your family, do stuff that makes you happy because you have to take care of yourself. And that's what I'm learning now. I've been sick a few times already, and you can't take care of others and your patients if you're not taking care of yourself. Tip number 10 is try not to take things too seriously. This job can be overwhelming. If you feel like the job is getting to you, which it really can, try to get some help. If you need to see a therapist, that's completely fine. That's completely normal. I love talking to my therapist about some of the feelings I have from work, and it helps immensely. So don't be afraid to ask for help outside of work, whether that's a support system like I said or seeking professional help, and it can really benefit you. And some of you might not ever get those feelings, which is totally fine. Either way, just take care of yourself. Okay, well, that is all the tips that I can think of. So I hope that these tips could help you as you start your first nursing job, which is so exciting. props to you for getting through nursing school. Never gonna want to do that again. That's one of the hardest things. But yeah, just be proud of yourself and know that you'll be able to get through this. And yeah, I hope I could help. All right, stay tuned. I will be posting more videos soon.